Hi, so the chapter that I am reviewing is Chapter 8, particularly the Ebola virus, how Ebola struck Liberia, where coincidentally Firestone had invested hundreds of $1,000,000. So the name in the book, or the title in the book, says Ebola strikes Liberia and Firestone strikes back, much like the Empire in Star Wars. Anyway, so Ebola, what is it? Formerly known as Ebola hemorrhagic fever. It is often fatal in humans. It is transmitted with human-to-human contact. And the average fatality is 50%. And that comes from the World Health Organization 2014 Ebola virus disease and how they define it. So the link between Firestone and Ebola in 2013, the first victim was a boy in Guyana. They did not identify it as Ebola, so his entire family did die from it. The disease was able to cross from Guyana into Sierra Leone as well as Liberia, and Firestone had built a rubber production facility there in 1926 and invested hundreds of millions of dollars into that community. So Firestone, because of its major investment, owns 118 acres for their facility. They employ approximately 80,000 people, and they provide employees with healthcare, education, and housing. They signed an agreement with the government of Liberia to put $100 million of improvements into the country's infrastructure. So they were heavily invested in that community. So when the first person to get the virus was the wife of an employee. She had come back from taking care of someone with the disease. They put her in an isolation ward. They used hazmat suits to protect the medical personnel rather than using it for the hazmat. But unfortunately, they were unable to save patient one. So they put all of their efforts into the community and focused on eradicating the disease rather than in making profits. In addition to focusing on the disease and making the community healthy again, they implemented an education plan. They went door to door, and they also used radio to disseminate information to let people know that you couldn't get it in certain ways, that it wasn't airborne, that sort of thing, that was actual physical contact. They used the news media to help them disseminate this information. The communication team was 8 professionals from an international agency called MSL, and they also not only transmitted this information but monitored the media to make sure that the message that they were sending was actually being received and transmitted like they were wanting it to. So the strategies, they had 2 strategies. One, they wanted to get reporters there to Liberia to see all of the things that they have done, be able to talk to the survivors, be able to talk to the on-ground physicians, that sort of thing. If they weren't able to travel, then they wanted to be able to tell the reporters their story and get their information out to the world to show everything that they had done. So the tactics they used were news releases that they distributed telling the story of how the tire company was fighting against Ebola, the prevention programs that they had implemented, the success in treating the supervisors, and the work with non-governmental health organizations. So what did they do different? Why is this such a success story? Well, they, again, rather than focusing on the profits, as most organizations do, they, due to the hospital facilities that they had, they provided voluntary isolation wards with sanitary supplies, which is huge in third world countries. They implemented the education program. They went door to door, and again, they used radio to disseminate the information. They developed screening protocols so that hospital personnel could identify and respond to Ebola patients, and so they could tell the difference. And then, of course, they implemented a reintegration program for the survivors to return not only to their families, but to their communities. So an evaluation of the Firestone case, they were able to implement a risk communication and social mobilization campaign that boosted community awareness. They were able to get their story out. They actually had 73 positive feature placements. One of them was the front page of the Wall Street Journal. They also had stories in multiple medical publications. And the CDC, or Center for Disease Control, identified them as what to do. That due to its response, Firestone was able to minimize the spread among the local population, and the CDC is recommending that by doing or implementing these same strategies elsewhere, that a case like the Ebola or another infectious disease could be able to be limited in transmission. So the references that I used for this were the CDC, the WHO, as well as the Fernbanks book. Thank you very much.